7 diseases that affect more women than men. Although most of these diseases can also be suffered by men, the truth is that they are much more common and dangerous in the case of women, so we must be alert. There are diseases that are exclusive to the female gender, such as those that have to do with their hormonal states or their reproductive system. On the other hand, there is a wide variety that affects both sexes, although not in the same way, and on the other, there are some diseases that affect women more. Its symptoms and effects differ significantly compared to how they occur in men. In fact, they can present in a more serious way. Taking into account that many do not know what they are, we want to share the main 7 in detail. 1. Osteoporosis, one of the diseases that affect more women than men. Osteoporosis is a chronic disease of the skeletal system. This causes the bones to become more brittle due to the loss of their density. It is also one of the diseases that affect more women than men. In fact, these represent up to 75% of diagnosed patients. This is because women have less bone mass from birth. In addition, due to hormonal changes, they lose it more quickly when they reach old age. 2. Celiac disease. Celiac disease is a condition that tends to manifest itself more frequently in the female population. Between 60 and 70% of people with this intolerance are women. It is characterized by a lesion in the lining of the small intestine, which affects the absorption capacity of nutrients and digestive processes. It is caused by difficulties in digesting foods with gluten, a protein that is present in foods such as wheat and barley. 3. Irritable bowel syndrome. The syndrome Irritable bowel syndrome is a disease that affects the functioning of the large intestine, leading to severe cramping, episodes of diarrhea, or constipation. Although men can also suffer from it, it is one of the diseases that affect women the most. And special for its hormonal activity and eating habits. Symptoms vary in each patient, but it is always necessary to modify diet and habits in order to control them. Although there is no exact cause established, everything indicates that genetics have a lot to do with the tendency to develop it. 4. Cardiovascular diseases. Cardiovascular diseases in women are on the rise. Unfortunately, it is one of the leading causes of death among this part of the population. This is largely due to the development of its symptoms, which tend to manifest when the disease has progressed to a higher level of severity. In addition, in some cases, the symptoms seem so common that it is not enough reason to consult the doctor. In fact, in the case of a heart attack, women do not usually feel the typical pain in the left side of the chest. Instead, they feel a burning sensation similar to reflux. 5. Cystitis. Cystitis is a condition that is caused by inflammation and infection of the bladder and urinary tract, almost always due to the abnormal growth of E. coli bacteria. It is more common in women than in men because their urethra is much shorter and, therefore, allows bacteria to pass more easily. Its symptoms include burning when urinating, the need to urinate frequently, and severe pain in the lower abdomen. 6. Rheumatoid arthritis. Rheumatoid arthritis is an inflammatory disease caused by wear and joint injury. It is an autoimmune disease whose cases are more recurrent in women and, although there is no exact cause established, everything indicates that it has to do with genetic factors. During its development, the immune system attacks the tissues. This accelerates wear and tear and generates severe pain that sometimes limits movement. Although there is no definitive cure, it can be combated with the use of pain reliever and anti-inflammatory medications, and some alternative therapies. 7. Asthma. Asthma is another disease that affects more women than men. From the adolescent stage, asthma becomes much more common in the female population. Hormonal changes and their effects on the body have a great impact on this condition. Airway congestion and breathing difficulties are the most common symptoms of this condition. However, it can present serious complications, requiring immediate medical intervention. Although its development is associated with exposure to toxins and polluted environments, it could also be linked to estrogens and progesterone, which appear to be involved in the behavior of the bronchial muscles. It is essential to know those diseases that, although they also occur in men, are more common and dangerous in women. Regular medical checkups and the adoption of healthy lifestyle habits are decisive to prevent its development.